Today we will discuss contraception. Now first you should know what is contraception. Contraception is referred to a deliberate prevention of conception. When we deliberately prevent the conception by any mode, either temporary or permanent, by using any drug, technique or devices, then it is called contraception. So it is a use of a artificial methods or technique to prevent pregnancy is known as contraception. And the contraception should have following features so it become an ideal contraception. So in an ideal contraception it should have following features like the contraception so used should be highly efficient, efficacy उसकी हाई होनी चाहिए. It should be free from any side effect or unwanted side effect, and the use of the contraception should be absolutely safe. It should be simplicity of use. It is very easy to use. There must be simplicity while using that contraception, and it must be a reversible means when we withdraw or when we stop using this contraception the fertility regains automatically easily, and it should be well tolerated by every woman. So these are the features of ideal contraception. Next, the methods of the contraception. There are the two modes of contraception, temporary and permanent contraception. Temporary contraception means it is used for a short duration of time for a meanwhile when the woman didn't want to get pregnant, but later on if she required pregnancy after withdrawal of these temporary method she easily regain its fertility. So temporary methods includes barrier methods, natural contraception, intrauterine contraceptive device, and steroidal contraception. These are the temporary modes of contraception. And permanent contraception means these are for those women who doesn't want to have child in future, doesn't want to be pregnant in future because family is completed and she doesn't want to have any pregnancy. So to avoid pregnancy she might go for a permanent method which includes tubal ovulation or tubectomy, and there is another method of permanent contraception in male, that is the vasectomy. So before we just explain the various modes of contraception, little knowledge of Pearl index is essential, and this is the Pearl index. It's used to measure the failure rate of contraception. So in contraception should be ideal, but in spite of that there might be some failure rate of the contraception, means along with the use of the contraception the woman may become pregnant. So that is the failure of the contraception. So we have to measure the failure rate of the contraception through this index, that is the Pearl index. And according to its definition, Pearl index, we get Pearl index by dividing number of contraceptive failures per 100 women years of exposure. That is, if we study in 100 women for a years and number of contraceptive failures occur while using the contraception is divided by the number of total women studies and for the month of use, this will give the Pearl index. So suppose there is 100 couples and they have used a method for a 3 years and have resulted into 24 pregnancies. So Pearl index is equal to number of accidental pregnancy after using contraception and per 100 women and for a years, that is 12 months, divided by the number of women which are observed or which are studies on which you are studying this Pearl index, multiplied the months of use, how many months they used that contraception. Suppose there is 100 couples which use certain contraception method for 3 years and resulted into 24 pregnancies. So the Pearl index will be, so accidental pregnancy is, in this case, is 24 multiplied 12 into 100, and this is divided by number of women which are studied in, that is 100, and for months 3 years, that is 3 into 12 months. So after simplifying this, you will get Pearl index 8. Next, come to the temporary methods of contraception. Natural methods, barrier method, hormonal methods, and intrauterine devices. These are the various temporary modes of contraception. We will study one by one. First is natural method of contraception. Natural method means it doesn't involve any devices, any techniques. It includes first totally abstinence. So avoid coition totally during that time where there is a more chances of becoming pregnancy, that is at the time of ovulation, a week before ovulation and week after ovulation. You should have total abstinence, which gives a natural contraception. Next, coitus interruption. Coitus interruptus means during coition all the semen is interrupted to enter into the vagina. Next natural method of contraception is lactational amenorrhea method. Now those women who gave birth to child and during the puerperial period, if she exclusively breastfeed to their child, it will give protection from becoming pregnancy, and this type of protection is known as lactational amenorrhea method, and it is exclusively in those women who exclusively breastfeeded, whose menses has not started, and up to the 6 month of the postpartum. Up to the 6 month of the postpartum, it will provide natural contraception. Next method is based on the fertility awareness. Fertility awareness means one patient should have a knowledge about the time of ovulation and try to avoid coition before 2 or 3 days and after 2 and 3 days of ovulation. That is the fertility awareness. Now the method how couple knows the time of ovulation. So for that there are certain methods. First is the calendar method or rhythm method. Second is basal body temperature method, and third is the cervical mucus billing methods. So calendar method is or rhythm method. So calendar or rhythm method is based on a Ogino-Cos theory, which states that ovulation occurs on 14th day. Okay, this method is based on Ogino-Cos theory, which states that ovulation occur at the 14th day plus minus 12. It may occur 2 days before 14th day or 2 days after 14th day. So in any regular cycle, if you want to know the time of ovulation, so you have to deduct 14 days from its LMP, which will give the time of ovulation, and few days 3 to 4 days before ovulation and 3 to 4 days after ovulation will give a protection. And usually unsafe period is considered as between 7th to 21st day in a regular 28-day cycle. So or through this one can know the safe period during which coition will not lead to any pregnancy. But if cycle is not regular, that is in irregular cycle, how will you know the exact time of ovulation? For that there is another method, that is one should know the first unsafe day and the last unsafe day. So first unsafe day is the shortest cycle minus 18 days, and for last unsafe days is the longest cycle minus 11 days. Through this you will get the unsafe period and avoid coition during that period. Next method is cervical mucus method, which is also known as billing method. In this, the character of the mucus secretion from the cervix will give information about the ovulation. So during the estrogen dominant phase, that is proliferative phase, the cervical secretions are usually thin. So if the cervical secretion is thin, that it means that ovulation hasn't occurred yet. But if the cervical mucus is thick, it thick of mucus is due to the presence of progesterone. So it will appear, or progesterone appear in the blood only after the ovulation. So it shows that ovulation had occurred. So through this method, you can know the time of ovulation by knowing the consistency of the cervical mucus. Next method is barrier methods. Barrier method are especially suited for the person who have contraindications to other mode of contraception like oral contraceptive pills or intrauterine contraceptives, or they don't tolerate um, this type of contraceptive method, or those who take a break for a period of time from oral contraceptive and IUCTs. So suppose a woman is using oral contraceptive pills and then they are taking few months back, and while uh, having a break during that time, she can use barrier method to avoid pregnancy. And it is also useful for those who are sexually active with a number of partners, and those who are personal reason prefer not to use oral contraceptive and IUCD, for them barrier method is a good options. There are two types of barrier methods, mechanical and chemical barrier methods. Mechanical barrier methods include diaphragm. So it is a type of a flexible rim which is made of a spring cup-shaped synthetic rubber of plastic, which is inserted into the vagina. It is like this. It is inserted into the vagina and applied to the cervix itself. So it prevents entry of the semen above this level. So it protects, or it provides a barrier for the sperms. Next method is cervical cap. This is applied directly itself to the cervix. Cervical cap. It is another barrier method. In the male, there are male condom which act as a mechanical barrier method, and in female, there are female condom which is known as FemShield, trade name. These are all are mechanical barrier method. Besides this, there are certain chemical barrier methods also, which chemically, when you utilize, can destroy the sperms and prevents pregnancy. So there are certain spermicidal agents which can destroy the sperms, like these are the various components, and these spermicidal agents, they are available in different forms, like in tablets, in pastes, in a creams, jellies, and vaginal sponges, which can applied and can act as a barrier. Like today is an example of chemical barrier because it contains chemical nanoxynol. Nanoxynol. It is a chemical which is a spermicidal agent. Now there is certain advantages and disadvantage of this type of barrier methods. Advantage is that it is very inexpensive, very easily tolerated, and give the good protection. But there are certain disadvantage, like it causes irritation, burning sensation else with this methods. Next method is mechanical, which I already discussed, like vaginal diaphragm or cervical cap, male condom, female condom. Next type of contraception is a steroidal contraception. There are certain hormonal contraception, which includes oral pills, injectables, implants, and intrauterine contraceptive devices. Now, first is the oral contraceptives. Contraceptives are usually combined oral contraceptive pills, and these are the hormonal contraceptive pills. Uh, These combined preparation can release hormones monophasically, biphasically, triphasic, or emergency or postcoital. So these combined oral contraceptive pills includes estrogen, progesterone, combined pills, and they can secrete these hormone monophasically, means for a whole day 1 to day 21 it secretes same uh, same amount uniformly, but biphasically in a one phase it secretes certain hormone, then in another phase it secretes another hormone. Like that, there is a triphasic oral contraceptives are also. Now, beside this combined oral contraceptive pills, there are single preparations only. Single preparations only means only estrogen and only progesterone containing pills are there. So only progestin only pills, which is also known as mini pills, contains progesterone only pills. They contain only progesterone. There is a no estrogen in that pills. Another, there are emergency cases, only estrogen pills are also used, but they are very rare. Nowadays there are certain non-hormonal contraceptive pills are also there, which has great advantage that it doesn't contain any hormones. These non-hormonal oral contraceptives for females, which contains centromen. These are the chemical centromen, and these present in the form of a trade name of Saheli and Chaya. These are the two non-hormonal oral contraceptive pills which contain centromen, and in males there is Genderusha, Gossipol, CCB, Nifedipine. These are the latest advancement for non-hormonal contraceptive pills for males. So combined oral contraceptive pills means it includes both estrogen and progesterone, and in this they consist of 21 tablets plus 7 tablets. Total 28 tablets are there. These 21 tablets, they are the hormonal tablets, and these 7 tablets are the iron containing tablets. So commonly used estrogen is ethinyl estradiol and progesterone is norethistedone. How will you have to take this oral contraceptive pills? It should be started from day 1, first any of the first 5 day of the cycle, any of the first 5 day of the cycle after menses, any of the day you will start this medicine, and you have to take one tablet daily, preferably at the bedtime, for 21 days. 21 days you have to regularly take one medicine at the bedtime. Okay, and it, now the second pack is started after 7 days irrespective of the onset or stoppage of the menstruation. So while taking 21 days, when you start this colored tablets, menses will appear, and after starting menses from day 1, you will start taking this medicine again next strip. And these type, there are certain family programs that these oral contraceptives are supplied free of charge by the government, especially Mala D and Mala N. Mala D is an oral contraception which contains estrogen and progesterone. Mala N is also an oral contraceptive which contains estrogen and progesterone. There is another trade name is Yasmin, which is also contains estrogen and the progesterone, but there are various other types of progesterones generations. First, second, third, fourth generation progesterones are used. Next, phasic pills. Phasic pills means biphasic and triphasic. Like all the 21 tablets contain estrogen and biphasic means all these tablets contain estrogen plus progesterone. But the dose of the progesterone doubled after first 10 days. Dose of the estrogen remain constant. So, like if there is a 21 tablets, each tablet consists of estrogen and progesterone, but during the first phase, only the dose of the progesterone is low, and in the second phase, the amount of the progesterone get doubled. So there is a secretion of the hormones in the phasic way. Quantity is changed during first phase and another phases. Similarly, there is a triphasic in which all the tablets contain estrogen and progesterone, but their dose varies in 3 phases. So, so the contraceptive pills, they can secrete hormones maybe monophasically, means all 21 tablets contain equal amount of estrogen and progesterone and they are secreting similar amount daily. But in biphasic pills, out of this 21 tablet during first phase, estrogen and progesterone with a low amount of progesterone, but in second half there is a double dose of progesterone will secrete. Similarly, in triphases, these estrogen and progesterones dose vary in 3 phases. Next comes to the mini pills. Mini pill is progesterone only pills. It contains only progesterone and there is no estrogen. And then this newer estrogen free pills available in India is Cerazette. CERAZETTE. It contains this progesterone and it should be taken daily, one throughout the cycle and at the same time each day. You have to take daily. And how will it helps in contraception? Because it inhibits ovulation. It prevents ovulations. Therefore, it causes contraception. Next is emergency contraception. There is an emergency contraception is Livono or Gestrol and I pills के नाम पे भी आती है. They can use as a emergency cases. Next is injectable contraceptive. There are certain contraceptive which can use in the form of injection. So it can be long acting progestins or there must be a combined injectables. जो injectables होते हैं वो प्रोजेस्ट्रिन लॉन्ग एक्टिंग प्रोजेस्टिन्स हो सकते हैं या फिर वो कंबाइंड इंजेक्टेबल्स हो सकते हैं. Long lasting progestins include DMPA, Depot, Midroxy, Progesterone Acetate and इसमें जो 150 mg की डोज होती है and this injection you have to take every 3 months. एवरी 3 मंथ्स पे ये इंजेक्शन लगवाने पड़ते हैं. मतलब एक बार लगवा लिया इंजेक्शन तो 3 मंथ तक आपको उसका contraception रहेगा and after that then you have to again go for this injection. So it requires repeated injection at every 3 months. Next type of injectables is NET-EN, norethistherone enanthinate. It consists of 200 milligram and for that every 2 months you have to take this injection every 2 months. So it will protect you from unwanted pregnancy for 2 months and it DIMPA protects for 3 months. Next type is combined injectables. Combined injectable means it includes DIMPA plus estrogen, means along with progesterone when estrogen is also added. So you have to take this medicine monthly. Similarly, NET-EN along with this estrogen, they are the combined. So long lasting progesterone. So DIMPA and NET-EN, they are the progesterone containing and they are required for every 3 months or 2 months according to the whether it is DIMPA or it is a NET-EN. Next type of contraception is implants. Implant is also known as progestins. So there are 2 types of implants, Norplants and Implanon. Progestin containing Norplants are progestin containing implants which consist of levonorgestrel. This is a progesterone and it provides contraception for 5 years. अगर नॉन इम्प्लांट लगवाते हैं तो 5 year तक का contraception होते हैं. It consists of the 6 flexible closed capsules which contains levonorgestrel. So this implants can be applied at subdermally, inner aspect of the arm, 6 to 8 centimeter above elbow fold under local anesthesia, and this can be given during day 1 to day 5. Implants, Norplants can used immediately after abortion or 3 weeks after postpartum. Mechanism, how it protects from pregnancy, because it inhibits ovulation or it causes atrophy of the endometrium, thickens the cervical mucus, and there is a one contraindication for that is acute thrombophlebitis. Next type of implant is implanon. It is also a progesterone, but its progesterone in it is desogestrel, but it provides contraception for 3 years. In it there is a single implant rod, one rod of 4 centimeter, which contains 3 keto desogestrel. So it has a very lowest failure rates. Next, intrauterine contraceptive devices. There are certain intrauterine means you have to insert devices directly into the uterus, which and prevents or blocks this area. There are broadly divided into two types: non-medicated and medicated intrauterine contraceptive device. Non-medicated are the first generation intrauterine contraceptive device, and medicated is second and third generation. क्या क्या होते हैं नॉन मेडिकेटेड और फर्स्ट जनरेशन का एग्जांपल है लिपे लूप. ये एक नॉन मेडिकेटेड ओपन इंट्रायूट्राइन डिवाइस है. इट इज नो लॉन्गर यूज इन इंडिया. दिस टाइप का होता है बिकॉज इट इज नॉन मेडिकेटेड होता है. सेकेंड जनरेशन इज कॉपर कंटेनिंग. जितने आपके डिवाइसेस हैं वो आपके सेकेंड जनरेशन में आते हैं, लाइक कॉपर टी, मल्टी लोड 250, मल्टी लोड 375, कॉपर टी 30A. ये सारे आपके सेकेंड जनरेशन कॉन्ट्रासेप्शन है. कॉपर टी 200 मीन्स ये जो आपके कॉपर के जो वायर हैं इट प्रेजेंट इन 200 स्क्वायर मिलीमीटर सरफेस एरिया पे वाइंड होते हैं, और इससे जो रिलीज होता है 120 मिली, इट कंटेन्स 120 मिलीग्राम ऑफ द copper. It releases 120 milligram copper, and copper T is applied for 3 years. 3 years the protection होगी. After that you have to remove it. Like multi-load is also provide protection for 3 years. Copper T 200, multi-load 250, they provide protection for 3 years. Similarly, there is a multi-load 375. It will provide contraception for 5 years. Next, copper T 380A, it provides contraception for 10 years. So there are the various types of copper T, copper containing intrauterine devices like copper T 200, copper T 380A, multi-load 250, multi-load 375. Next, third generation medicated devices. Third generation include progestasert and Mirena or levonorgestrel. Progestasert, it consists of the progesterone. ये progestasert ये भी एक टाइप्स का आपका थर्ड जनरेशन इंट्रायूट्राइन कॉन्ट्रासेप्टिव डिवाइस है. इसके अंदर जो कंटेंट होता है वो आपका प्रोजेस्ट्रॉन होता है, एंड इट प्रोवाइड कॉन्ट्रासेप्शन फॉर 1 ईयर. तो ठीक है, प्रोजेस्टेरोन इंसर्शन के बाद 1 ईयर तक ये कॉन्ट्रासेप्शन प्रोवाइड करता है. नेक्स्ट इज मिरेना. इट इज ऑल्सो अ इंट्रायूट्राइन कॉन्ट्रासेप्टिव डिवाइस दैट इज levonorgestrel 20 IUS. It provides contraception for 5 years. Mirena provide for 5 years. Next, permanent method of contraception. In female, there is a tubal occlusion or tubectomy and eschore, and in male, vasectomy. These are the permanent method. Eschore is a permanent method. In it, a micro insert placed into the each fallopian tube. ठीक है, through hysteroscope, a micro insert is introduced and placed into the fallopian tube using this catheter, and these ensure micro inserts expand to fit the tube and anchor them in this place. Like this, it will block this fallopian tubes, and after 12 weeks the tissue grows into it. This tissues grows into it, and it will lead to a permanent barrier. And this is, so it's a permanent method of contraception in females. Next, tubal ligation or tubectomy, in which the fallopian tubes are cut or they are ligated so that ova will not able to reach the uterus. So it is also a very highly effective, safe and simple procedure, and this Tubectomy can be done during puerperium, 24 to 48 hours following delivery, or for 3 months after delivery, or after abortion, or it can be done along with MTP. Next is male sterilization is the vasectomy. What is vasectomy? It is a permanent resection of vasa deferens bilaterally, and it is a no scalpel vasectomy which can done under anesthesia, NSV. NSV is a no scalpel vasectomy. It is a simple technique and it is an OPD process, and it has minimum failure rate. Only the disadvantage is that for 2 to 3 months after this NSV, male has to take another method of contraception, especially barrier method, because uh, at least 10 to 15 ejaculation is required to remove all the sperm which are present beyond this ligated part. So additionally, for 2 or 3 months, another mode of contraception is required following operation. And another disadvantage is it may cause physical frigidity. Now, there are certain newer contraceptive methods which are introduced in family planning program. Newer methods is that is the Antara program. Antara is program include DIMPA, which is a type of injectable contraceptive, and it provides contraception for 3 months. So you have to take this injection every 3 monthly. Next program is Chaya program. It is also a non-hormonal contraceptive methods, and it contains chroman. Okay, and this contraception you have to take once in a week. This you have to take once in a week. Next is progesterone only pills, POP, and it is for the lactating mother. For those mother who are lactating, for them the best oral contraceptive is progesterone only pills. Next, Nishchay is a pregnancy detection kit. So it is services for early detection of pregnancy. Okay, so on the basis of this knowledge, we just do this exercise. One question, you have to match correct answer from the one option of the list 1 to the list 2. First is Nishchay. What is Nishchay? It is a home based pregnancy kit. Antara program, it is a DIMPA, that is contraceptive injectable methyl MPA. What is Chaya? Chaya is a oral contraception, Sencroman. Progestasert is a third generation IUD. So the correct answer is this one. And lastly, Lipeloop multi-load 375 copper T, copper 7, LNG 20, progestasert. Correct match is Lipeloop is non-medicated IUD, multi-load is copper containing, copper T copper containing, copper 7 copper containing, LNG progestasert is hormone releasing LNG, and progestasert is hormone releasing intrauterine devices. So I hope you can easily understand this contraception.